Hello, I am an MRI user. Today, we will look at the MRI cervical spine foraminal view, which is being examined for the diagnosis of cervical neural foramen stenosis. Cervical neural foramen stenosis causes cervical radiculopathy, often caused by a herniated disc or osteophyte. When neural foramen stenosis due to intervertebral disc herniation or osteophyte is discovered, it can be confirmed that the patient's neurological symptoms originate from the neural foramen itself, not the distal part of the neural foramen. To evaluate cervical bone foramen stenosis, radiography and MRI are taken together, and it is difficult to evaluate well with only sagittal and axial images in MRI examination. For this reason, additional MRI oblique images are being used. The spinal cord is a part of the central nervous system that is connected to the brain and is located in the spine and includes both sensory and motor nerves. There are 8 cervical nerves, which control breathing and are responsible for sensation in the arms, neck, and upper torso. Nerves branching from the spinal cord exit the spinal canal in pairs through the neural foramen and then branch out further to form the peripheral nervous system. This figure is an image reconstructed as an oblique view using MPR from data scanned with caret. The picture on the right shows the cross-section of the image cut with the white line of the axial image, and you can clearly see the narrowing of the neural foramen due to the osteophyte. In order to see the paired neural foramen of right and left, each scan must be performed separately. In order to show the neural foramen well, the scan should be perpendicular to the direction of the neural foramen. From now on, I will introduce the MRI scan method for viewing the neural foramen. First, set the default image plane to the sagittal plane. Second, a coronal image with a good view of the spinal cord is selected. Thirdly, select an axial image that shows the neural foramen well. If there is a spine level to check, select the axial image of that position. For example, if you want to check C4 in C3, select the axial image of this location. After determining the 3 planes, sagittal, coronal and axial, proceed to the next step. First, place the position block parallel to the entire spinal cord in the coronal. If you examine the right neural foramen first, move the position block to the right as shown in the picture. The position block overlaps a third of the spinal cord. Second, rotate the position block at an angle of 45 to 50 degrees perpendicular to the right neural foramen in the axial direction. After this, it will start scanning. The thing to be careful about here is to first manipulate the position block of sagittal, which is the plane to be obtained, and then to coronal and axial in order that you have to proceed. This is because changing the angle of the position block changes the shape of the position blocks of other planes, causing confusion. The left neural foramen is also imaged in the same way as on the right. Currently, images of the cervical spine foraminal view are performed with an examination time of less than 2 minutes for the right and left sides. If the required area cannot be scanned due to an incorrect scan plan, the entire scan time is reduced because it must be rescanned. It stretches and is prone to artifacts caused by patient movement. Therefore, sufficient preparation and practice are needed to set up an accurate scan plan. So far, we have learned about the MRI cervical spine foraminal view. MRI must be completed within a set time period so that patients may not move. Therefore, MRI users should be familiar with scans, and they can do well by doing many tests. Cheer up and be happy. Thank you.